Good morning to everyone attending this online webinar. My name is Rihil Birov. Thank you for joining. And you are probably here because in one way or another, you've heard about the Digital Health Uptake call for Twinnings, and you are probably interested to learn more. So that is why we are organizing this event. In the next hour, we'd like to cover with you a bit the background to why we have this twinning program in the context of the European Commission priorities and also the DHU project. We'd then like to introduce you to the call for Twinnings that is currently ongoing. And we have enough room for any questions you may have, any comments and ideas about possible twinning topics and twinning partnerships that you'd like to create. So together with me today, I have Mirella Negrean from the European Commission from DG Connect, and also John Farrow from the Reference Sites Collaborative Network. I will start very briefly with a bit of an introduction into the project. So again, I am from Empirica, which is the coordinator of the Digital Health Uptake project, and it is a 2-year project funded under the Digital Europe program. It is a coordination and support action implemented by 7 partners that you see here: Empirica, the European Innovation Institute, Institute for Innovation Through Health Data, ETE, Digital Europe, ECH Alliance, Reference Sites Collaborative Networks, and F6S. And together through the project, we are addressing the need to align, strengthen, and coordinate policy, strategies, instruments, and activities regarding the uptake of digital health solutions and services in Europe. And we're doing this in 3 main areas, which are our goals in the project. The first one is actually understanding what is out there. So monitoring, analyzing different types of digital health innovations and solutions out there and their uptake into health systems in regions, member states, and countries that are associated to the Digital Europe program. The second area that we're looking at is to create an environment of cooperation and active stakeholder contribution to facilitate regular exchanges between the demand and supply through a series of events and other opportunities. And the third area that where also Twinnings fall in is to strengthen capacity building for implementation by identifying relevant tools, methods, providing guidance, and stimulating mutual learning and transferring of innovative practices. So for the first area, the monitoring and analysis, what we have launched so far in the project is our DHU radar. So this is the place where anyone can upload and let us know about existing digital health innovations or practices. This can be a digital solution, this can be a service, it can be a method that you're using, it can even be a business model. So it is very easy and very quickly one can enter basic information and let us know about the existence of these solutions with the aim of raising awareness, letting the community know what is out there. And we, as part of the project, will be looking at this repository of digital innovations and trying to analyze it, because we need to learn more about the uptake and we need to promote those solutions to others. So part of that process is analysis and then highlighting interesting innovations through spotlights. As I said, it's very easy to do it. You need to log in and submit your practice. We ask for very few items so that you can actually quickly, under 5 minutes, enter a practice. You need to describe the maturity, the geographical scope of the practice, and then you have also optional fields that you can consider putting more information so that we better understand the context of your innovation. I would strongly recommend that you, if you are the owner or you know of any relevant practice, that you head to the radar and have a look at what is already in there. We have more than 130 practices already on the radar, but you might also want to upload your own. The second area we talked about was the digital community or the knowledge community, where currently we're planning internally in the project, and we'll launch with several events starting from September. The whole idea of this area of the project is to address unmet needs, to address challenges that are existing. And one way actually to learn about challenges is also looking at the radar and seeing what solutions are out there and what solutions and categories are not so that we can search for champions that are more advanced in this field and help us elaborate targeted resource packages, for example, and just generally engage with the community to address these challenges in a more efficient way. So stay tuned on the website. Very soon we'll be putting information about upcoming events in the fall. The third area, which we call the accelerator, is where also the Twinnings come in. We're looking at providing support, both technical support, but also financial support for the implementation and scaling up of things. And those things can be tools. We know that if you want to upscale, you very often look at the different tools and supporting information that you need for the process. So that is one piece of the work. A second one is the Twinnings that we'll discuss a bit more in detail today. The third one would be actually providing technical assistance and training, meaning some of those tools are not straightforward to be used, and you need to learn from the creators of those tools or from trainers how to best make use of them. This is just, yes, the brief overview of how the project fits into the picture, and I'd like to now ask Mirella to give us a bit on the European Commission dimension.
Okay, thank you. Thank you, Rahil. So I'm Mirela Negran. I'm working in the DG Connect in the unit e-health, well-being and aging in DH3. Our work is basically based on the Commission communication from 2018, number 233. This communication is divided in three pillars. First one, the secure access and exchange of health data. Second, the health data pool for research and personalized medicine. And the third one, where it goes also this project, the digital tools and data for citizen empowerment and person-centered healthcare. Yes, thank you. The digital technology is changing people's lives. The EU's digital strategy aims to make this transformation work for people and businesses. In her political guidelines, Commission President Ursula von der Leyen stressed the need to lead the transition to a healthy planet and a new digital world. One of very important priorities is the Europe Fit for the Digital Age, empowering people with a new generation of technologies. So the European Commission is working on a digital transformation that will benefit everyone. Digital solution that put people first will open up new opportunities for businesses, encourage the development of trustworthy technology, foster an open and democratic society, enable a vibrant and sustainable economy, and help fight climate change and achieve the green transition. The Commission is determined to make the current 10 years Europe's digital decade through accelerating Europe's digital transformation by 2030. The path to the digital decade is the Commission's proposal to set up a governance framework to ensure Europe reaches its 2030 digital decade objectives. So you see here we have the digital skills with a target of 80%, digital infrastructure, digital transformation of businesses, and also the digitalization of public services with the target to have 100% of Europeans with access to digital health records, another area on which my unit together with Santa is working on. Okay, thank you. So digital technology and use of data are the future. Nevertheless, the biggest challenge to overcome is the integration of technology and data into our daily lives and into the health and care delivery processes to create positive impacts in citizen lives. So one of the important instruments to do this is the Twinnings, what we are doing here. The European Commission not only supports cities, regions, and countries to achieve successful digital implementation, but to share their experiences and knowledge with others who want to adopt successful digital practices. Twinning enables the uptake of successful digital solutions and it strengthens the scaling up of innovation in the health and care sector. Okay, so I will now tell you a few words about a few European projects that have implementing already Twinning. So in case you want to have more information on this and be inspired, we have the well-known, you most probably know it, the European Innovation Partnership on Active and Healthy Aging, EAP-AHA, the Scirocco Exchange Project, the Scale-AHA study for the Gatekeeper Project, the Digital Health Europe, which Rahil knows more about, and the Info-AHA project, yes, that had funded 10 successful Twinnings applications in 21-22. Okay, so you can Google this and find more information. So as I told you, Digital Health Europe, it okay, it had 55 adopters that were able to implement digital health and care solution, 21 Twinnings, and was supported by 24 originators. Yes, I will say a few words. I'm taking this opportunity to say a few words also about what our current work is on and that may be of interest to you and in the near future. So the Health in Digital Europe Work Program 23-24, we had already launched the calls, Genome of Europe and Federated EU Infrastructure for ECU data. I think the deadline is sometimes in September. So if you are interested, please apply also to this. As you'll have more time, seeing that Twinnings are only for a few months period long. Health data space, here the call is about to be launched. It's patients access to data. And we have also a procurement call to be launched soon, the platform for advanced virtual human twin models, VHT models. Okay, thank you. And a little bit about financial support to third party, what this twinning is actually about, as we are giving a grant to the to DHU, and you are benefiting from this. You will have more information, and your actually first point of contact should be Strahil, in case you have more questions on this. But I will say a few words on this financial support to third parties. So you are this financial support to third party from us can have different different ways of being applied to prizes, through Twinnings in your case, scholarship, fellowships. Yes, one of the few that I mentioned. There are a few rules. You can find more information on in this guidance and manuals on Europa.eu in the article 6.2 DX, page 94 of the annotated grant agreement, for example. And yes, and there are some eligibility conditions related to this. Okay, you can read more there about that. Thank you. Okay, if you have any questions, thank you.
Indeed, the call scheme that we prepared has a lot of information already there, so we are complying with these provisions. But yes, if you have any questions, feel free to get back to us. Thank you very much, Mirela.
Thank you, Strahil.
Next, we want to do a bit of a deep dive, or at least a bigger dive into the actual call for twinning. So we have John Farrell from the Reference Sites Collaborative Network.
Thanks very much, Strahil. Good morning, everyone. Next slide, Strahil, please. Or maybe I can push it on myself, yeah. Okay, just maybe by way of a slight overview on what a twinning scheme is for those that are unfamiliar with it. It very much is, as Strahil has mentioned earlier, it's a support mechanism that we actually provide through the project to enable and facilitate that scaling up of digital innovation solutions from one region to another region, and funding is provided to support that. So it is. There are two key players in a twinning. The first is what we refer to as the twinning originator, and the twinning originator is the organisation, the region that has got that evidence-based solution, and in this case, it's digital health technology solution that is available for transfer to another region. And then we have the second party to the twinning, which is the twinning adopter region. And that is a region that when they look at their health and care needs, their priorities, and they identify a gap, and they actually have identified as well that there is a solution that is operating successfully in another region that they would like to consider to adopt in their own region. So they want to learn more about it, and therefore they are the twinning adopter. Now, you can have more than one region that is interested in the same solution. So you could have multiple twinning adopters that would be taking part within the scheme. And the twinning examples, the types of activities that would be supported through the twinning would include the costs for the hosting of meetings, both within the originator site and the adopter sites, organising any technical groups that may be necessary that they can sort of look at and begin to understand the detail of the solution, the travel costs and the accommodation costs to support any visits between the originator site and the adopter site or sites. When we look at Twinnings, there have been a variety of Twinnings which Mirella has already alluded to in her presentation, and our experience of them is that those Twinnings normally last between 3 to 9 months, and that very much depends on what is the subject matter and what do we want to see achieved through the twinning itself. If we are looking for something that is moving towards that partial adoption of a twinning of a digital health technology solution, it obviously will take slightly longer for that. But in terms of the twinning within the digital health uptake project, we're looking that those twinnings are going to be somewhere in the region of about 6 to 8 months in duration. So they are. Next slide, please. So what we're looking for from all of this is that the twinning solution we're looking for is about the digital know-how that we're looking to transfer through the twinning activities from the originator site to the adopter site. The topics that must be included within the twinning scheme here are those that are based on digital technologies, and they may be evidence-based products, the services, the processes, the methodologies, the strategies, or the business models that have been scaled up in the twinning originator's own country or region. And they must be innovative and should not have been used by the adopting region before the twinning takes place. And the two important messages here is that, firstly, the digital health technology solution must be evidence-based, so it must be operating at scale within the region that it is coming from. And secondly, that the adopting region must not have been using that solution before the twinning takes place. So those are the two key criteria we're looking on in this here. Next slide, Strahil, please. So what are we sort of offering in terms of support for the twinning? In total, we have got about €96,000 available for it, and we're expecting to have 12 twinnings that will take place during the scheme, which means that each twinning would receive a maximum funding of €8,000 for the twinning. The funding is made available through the project, and as Strahil and Mirella have already mentioned, we're actually making this provision through the financial support to third parties, or another term that's used for it is the cascade funding. And although we're providing the budget through the Digital Europe programme, it's proper to say that the EU is not part of the award process for this. Next slide, Strahil, please. So the types of topics that we would be expecting to see come through in terms of the twinnings, and there's a whole range of them here, and I'm not going to go through every single one of them. So we'll leave the slide up for a few seconds whilst you actually sort of peruse what's on the information that is there. But generally it's about digital tools that support health education, improving health literacy, digital health literacy. It's about the use of digital therapeutics. Other areas could be on robotics or companion robots. We could be looking at digital tools to support patient feedback and reporting of outcomes and experiences, supporting proactive prevention, self-management, home care, telemonitoring, the digital solutions that were in that field. Also solutions on virtual consultations, virtual coaches, personal assistants, and regional, national and local electronic integrated health record systems, and the integration of those electronic health records and social care records, looking to bring together that integrated health and social care perspective. So there are a range of digital health technology solutions that we're looking to take forward within all of this here. Next slide, please, Strahil. Yeah, and maybe before I sort of mention that, it's useful just to refer to where is an adopter site likely to find some of these solutions that they might be interested in. There are a few sources of reference One will be the DHU radar, which Strahil has explained, and he had mentioned that there's over 100 digital technology solutions already registered on the radar. So that can be a first port of call for any region that is looking to see, well, what are the technologies out there, and could any of those help us in what we're wanting to achieve within our own region? So a first port of call could be to check on the DHU radar. And when you find the digital health solution, then it's a matter of making contact with the originator, and the originator's details are on that. A second avenue that can be explored could be the relationship that exists already between different regions, maybe through knowledge that they have already shared with each other on different projects that they have been involved with in the past. And there is an awareness that some digital health and social care technologies have been developed as part of that, and that could be another source of identification within it all. Also checking on the Futurium platform of the EU Commission, you'll be able to identify repositories of good practices in there. And a fourth avenue that you could explore for those that are active and healthy aging reference site regions is to contact the RSCN, and we can actually help to identify through the digital good practice solutions that we actually have a record of from the fourth call for reference sites. We may be able to identify some potential partners for you on that. Equally, on the RSCN website, if you went in to look at the individual tabs for each of the reference sites, you will also be able to identify maybe some digital technology solutions that those reference sites are promoting in terms of what they have achieved and the evidence-based impact that it is having on the citizens in their own region. So looking then, how do we go about applying for it? It's what we call a competitive twinning tender. The twinning scheme itself was launched on the 13th of June. And what you need to do then is to download the documentation from that and complete the application. And all the applications will then be evaluated after the closing date. The applications should involve organisations from countries that are participating in the Digital Europe programme. And at the time of launching the call, these countries are the EU 27, Iceland, Norway and Liechtenstein. At present, if there's anyone online from Hungary, you would need to check the current position on the EU Council decision in 2022, on the 16th of December 2022, in terms of the further eligibility of Hungarian regions to be able to apply for this. At the minute, it is not the case, but if that changes, you need to be contacting your national contact points. I've also noticed that there are some representatives from UK regions. UK regions are not eligible to apply for funding under this twinning call either. The focus on the twinning is therefore going to be on local, regional and national health and care providers across Europe that wish to adopt digitally enabled innovative solutions that are available for transfer from elsewhere. So it's important that the health and care provider organisations are part of that twinning adopter approach. The twinning originator and the adopters must be from different countries. So we don't want to see through this here from one region in one country to another region in another country, that type of twinning. We want to see it across countries within Europe. And an organisation may participate in more than one twinning application, as long as the twinning solution and the twinning activities are both significantly different. So there's an opportunity not just to limit yourself to one, but you could go after a number of twinnings, but you need to ensure that those solutions are different to each other. Next slide, please, Strahil. So whenever it comes to the application itself, whenever the originator and the adopters get together, what you should do is agree who will become the twinning contractor, because that will be the organisation that the project will have the signed agreement with. So agree who that contractor will be. It may be a twinning adopter organisation, or it could be an originator organisation. or indeed it could be a third party that is part of the twinning. So it could be an organization that's not a healthcare provider, but is part of the adopter region, and they could become the contractor. The application form should be completed and submitted before the deadline, and the email address is up there for it. The email address is also on the guidance document and all the information regarding the Twinnings on the DHU website. And it's important that the email that you send must contain a searchable PDF attachment, clearly named DHU, the twinning offer, and whatever the short name of the twinning is that the originator and the adopters are proposing to give to that twinning. The successful applications will then be offered a contract by the Digital Health Uptake Coordinator, and that contract will need to be signed before the twinning can actually commence. And if there are any questions on any of the call documents or the call process itself, they can be sent to the email address twinnings@digitalhealthuptake.eu before the deadline for questions, which is set out in a twinning calendar, and we'll have all the dates for all the actions that need to be completed within that. It might be the next slide. Next slide, please. No, it's the one after this one. So when it comes to the evaluation itself, it's important to note that the evaluation will be carried out against 3 specific criteria. The first one will be about the excellence of the proposed twinning. The second area will be on the impact of the proposed twinning, and the third will be the implementation. So it's important in your application that you're actually looking at those 3 dimensions whenever you come to complete the information. Importantly, you must be able to demonstrate what is the impact this twinning is going to have in the adopter region going forward into the future. So that's, please pay attention to that. In terms of when we would expect to announce the results of the twinning, the results of the twinning will be announced at the beginning of October. And we're also sort of have got a split weighting in terms of the twinning itself. So we're going on a 70-30 quality price weight that will be applied to the applications going forward. And that's to ensure that there is fairness and equity, but also that the twinning is going to have the biggest impact back on the adopter regions in order to let them go forward as part of their own transformation or change programs. Next slide, Strahil, please. Okay, so come to the twinning calendar here. So as I said earlier, the call was launched on the 13th of June, and this is now the second of the 2 information webinars that we're actually holding. If there are any questions that you have on the twinning, the application, or anything, you have got until the 13th of August to actually submit those questions to the project, and we will come back with the responses to those. And then 1 month later is the deadline for the submission of the twinning applications. So at 5 o'clock Central European time on the 13th of September, that will be the cutoff date for the applications. We will then, between the 13th of September and the beginning of October, we will have our evaluation process, and that will be independently conducted. So it will. And then on the 2nd of October, we're proposing that the award decision and notification will be published. And then during October, we will spend the time getting the agreements to the different twinning contracts, the 12 twinning contracts that will be in place. And that sort of brings us to when will the twinning commence? Well, we're sort of looking at the earliest that we'll be able to commence will be at the beginning of November, but the latest date for the end of the twinnings will be the 31st of October next year. So that's the calendar going forward. So the key dates to remember from that are the 13th of August for submitting questions, the 13th of September for the application, and for those that are successful in being awarded the twinning, to ensure that you have the twinning agreements and the contracts signed before the end of October to allow you to start at the beginning of November. Next slide, please. Okay, and that's it. So a fairly quick run through the process that we're proposing to adopt. So at this stage, we're happy to take any questions that you may have. Please use the chat box for it. But if there are any questions, we'll try to answer them now. And if not, we will follow up on the DHU website after this webinar.
Yes, there are already a few questions in the chat. And we have to say, we have to please wait for the final written answers, I would say, because we're giving now some preliminary answers on the spot. But as John said, we're collecting questions by the 13th of August. And after that, we'll post on the website and we'll contact everyone who has downloaded the code document. So everyone that has shown interest will get an update with a link to the official answers to those questions. But one that I can maybe answer, which I'm more sure about, is whether Turkey is eligible. So at the moment, Turkey is not eligible because it is not part of the Digital Europe program. There was another question about could a cluster apply as an adopter? And again, here we'll need a bit more information what the cluster is. To my knowledge, that's not a legal form. I can imagine it's some kind of a grouping of different organizations, in which case I would suggest that if you have multiple adopters, each adopter can be part of the twinning. We said there can be one-to-one twinning or one-to-many twinnings. If you have more adopters, then the impact is bigger. So you're more it's better for your evaluation, for the evaluation of the twinning.
Yeah, just on that, Strahil, if I could maybe sort of add as well. I know there are a number of clusters that are operating, mostly maybe across Spain. The important thing is that, yes, it's okay. I would have thought that cluster can apply as an adopter, providing it has the health and care provider as part of it, because we're looking for the solution to be transferred to the health and care providers. So they have to be able to look at the implementation of it. So in that case, the cluster would need to contain the health and care provider. Sorry for cutting across you there, Strahil, but
no problem.
There's a question here. Is there any financial support for the acquisition of technology inside a twinning? No, there is no funding to support the acquisition of the technology itself. This is about looking at the learning that is coming from it, understanding the technology that is actually being used in the originator site, and then the opportunities or the potential for that technology to be used to be adopted by the adopter region into the future. But no, you would have seen from the funding that is available, €8,000 to provide the whole support for it. And also talking about in order to deploy a pilot, that's maybe sort of moving into something different in terms of maybe looking at another funding call and maybe sort of looking at the development of pilots to support the transfer and the implementation of new digital technology solutions. So it's not exactly what a twinning would be about. Is there anything you want to add to that, Strahil?
No, and linked to the next question, which is about TRL levels. Again, I don't think we have TRL levels specified explicitly in our call. It is about, as John said, evidence-based practice that already is established somewhere. I'm not sure, it's probably TRL 7, 8, 9. It doesn't really matter, but it's already tested and proven somewhere, and now it can be transferred, or someone wants to learn how to transfer it somewhere else in Europe. That's what also the definition of innovation according to the Commission is. So if it's something new to the adopter region, it is innovative. And no, TRL levels we don't mention explicitly.
Yeah. Question, suggestions for finding partners for beginners. A couple of tips that I had mentioned in the presentation is one is if you're the adopter, then if you look at the digital health uptake radar and you go onto the DHU website for that, you will see over 100 digital technology solutions are listed on that. So that will also help you to identify which region or organization has implemented that digital technology solution. So you could look at that and you could find out and say, there is a solution, and that meets the needs of our own region, and therefore make contact with the originator and invite them to join you in a twinning application for that. So that's one avenue that you could explore. The second avenue you could explore, if you are an active and healthy aging, active and healthy living reference site, and you're part of the RSCN network, is that you can contact the RSCN, and we can maybe help you to identify through another region a technology solution that you're actually interested in. You could also check the RSCN website and look at the tab specifically for reference site regions, and you could identify from that tab any of the reference sites in there that you think might have a solution that could be useful for yourself as well. A third avenue could be look towards the Futurium platform, and see if you can identify within it potential digital health solutions that are listed as good practices within that. And then the fourth is through your own personal contacts. So do you know someone from another region? Are you interested in work that they have done or a solution that they have implemented? And could you invite them to join into the Twinning partnership with you as well? So those are the four ways and the four easiest ways that you could maybe sort of try to identify an originator of a digital health technology solution that you could be interested in. There's another question here. Could a consultancy firm participate to support the twinning process? Is there a limit for its funding? We would not be funding providing any funding to any region that in preparing its application. You know, there is no funding for preparation of application in this at all. If a region wishes to engage a third party to help them in that process, that would be at their own cost, so it would. Can a patient non-government organisation participate within their digital health management ecosystem? Again, as long as the health and care provider in the region is part of the twinning adopter, then there's probably no reason why a patient NGO could not participate, but it would need to be very clear in terms of what is the role of all the different organizations or actors within the adopter region when it comes to the twinning. So, you know, how would the patient NGO be benefiting from participation in the twinning, i.e. what would the expectations of the health and care provider be of the patient NGO if the solution was supported and was adopted? So it's a conversation to have internally with the health and care provider, I would suggest. Another question, in the list of participating countries in Digital Europe, Turkey was already answered that, Strahil.
Well, the person is asking again because it seems to have different information. We can double check that. The information I know is, and I'm looking at the Digital Europe program, it is mainly focused on EU member states, and the decision to associate the country is left to the Commission. And currently I'm reading that only Iceland, Liechtenstein and Norway are associated. But if you have different information, please do share it with us so that we have a look. Of course, we don't want for you to spend effort on preparing an application if you're not eligible. So let's clarify that in the next weeks.
Yeah. And also thank you to Diane for sharing the link to the DigitalHealthUptake website that's in the chat box as well. So just thank you, Diane. Are there any further questions? You may not now, but you know you have until the 13th of August. So if there are any further questions, please do submit them into the DHU project. And maybe Strahil, if you could just remind us what the email address is for the questions.
Yes, it is twinnings@digitalhealthuptake.eu.
Okay.
Okay, I see a new question. Is there any limit of being candidate if we had some DHE twinning grants before? So this was a previous project, Digital Health Europe, DHE, that also had twinnings. And yes, we have to see. I guess it's a different twinning. Even if you've been a beneficiary, I assume that either the topic is different, or if you're I don't know your case, if you're an originator, for example, I think you are, Kebape, if I remember correctly, then you want to now bring your knowledge to other adopters, which are different than the DHE adopting beneficiaries. So this should be possible. Yes, someone made the point that here it's helpful to see. Maybe one thing we can offer, if you're a originator or adopter seeking for partnership, but you're not successful at the moment, maybe the project can help. In this case, you can just write us what you're looking for, or as originator, what you're offering, and then we can try to share through the social media channels of the project and see if someone responds to you. So we can give the details of what you're looking for and your contact details, of course, if you feel that's okay, and to use the channels of the project to reach out.
And just on that, Strahil, if there are any originator organizations that have a digital health technology solution but haven't uploaded it to the DHU radar at this stage, please do so. It's a great opportunity to be able to promote that solution, across Europe by having it into our radar. Don't see any more questions coming through, Strahil. So maybe.
Okay, we have one last one.
Oh, okay, there we go.
We found a technology worth implementing in our region inside the framework of a twinning, but we do not have the money to validate it with a pilot. So where could we find funding for the acquisition of technology in order to complement the twinning? That would have to be a different funding instrument, I guess.
Yeah.
There are quite a few projects, research and innovation projects, innovation action projects, RIAS and IAS, who focus on pilot, offering funds for piloting of solutions. But yes, this is, I guess, not in scope of our call here.
No.
Okay, as said, if you have any more questions, there's the channel, and you have up to the 13th of August, so feel free to submit them, and shortly after that, we'll be providing the answers to everyone who has downloaded the codocs. Thank you very much for joining. Thank you to John and to Mirella also for speaking, and hopefully we can start with a fresh set of twinnings later in the fall. And work towards uptake and transfer of those practices in the coming months. Thanks a lot, and have a nice day.
Bye, everyone.
Bye-bye.